Good evening, everyone. My name is Mark Nordenberg. I'm the former chancellor of the University of Pittsburgh and currently have the privilege of serving both as the chair of Pitt's Institute of Politics, also affectionately known as the IOP, and as the director of its Dick Thornburgh Forum on Law and Public Policy, also known affectionately as the Dick Thornburgh Forum on Law and Public Policy. It is in the IOP chair's role that I extend a welcome to all of you tonight. And I extend that welcome not only for myself, but also for Samantha Balbier, the director of the IOP, from whom you will hear not too much later in the evening, and all of the members of the hardworking, talented IOP team who have made this particular program possible. I also want to extend a warm welcome on behalf of our partners in this initiative, the Pittsburgh Foundation and its president and CEO, Lisa Schroeder, the United Way of Southwestern Pennsylvania and its president and CEO, Bobby Watt-Geer, and all of the talented members of their teams who have been invaluable and committed collaborators in pushing this program forward. I also want to express our most sincere thanks to Diane Holder and the UPMC Health Plan, not only for sponsoring the program this evening, but for being such a force for good within our community. Just a little over a week ago, the UPMC hosted the U.S. Surgeon General as part of a national tour focused on youth mental health. Among other things, that visit underscored the importance of the topic that we have gathered to address this evening. We're also deeply grateful to Jane Werner and the Children's Museum, which is both nationally ranked and locally beloved for all of the wonderful things it does for the children of this region. This evening, we have been permitted to use the museum's magnificent facilities for a purpose that could never have been envisioned when they were being constructed. In fact, the dissonance between the image that we all have of this museum, large numbers of happy children engaged in the process of learning, and the reasons for this gathering stand as a stark reminder of the somewhat dark place in which we find ourselves today. As almost all of you know, the IOP, the United Way, and the Pittsburgh Foundation are nonpartisan nonprofits that have long histories of making impactful contributions to the good of the region. Another thing that these three organizations have had in common is that none of us was involved in any way in gun violence programming. That direction changed when the CDC reported that gun violence had become the #1 cause of death for children and teens in this country. That was such a jarring finding that we decided we could not any longer do nothing, and concluded that we might have greater impact if we partnered and did something together. In the end, we decided that at least as a first step, we would jointly present a series of forums designed to enhance this community's understanding of this crisis, better positioning it to respond. These programs can also be viewed as our invitation to work together as a community for the physical safety and emotional well-being of our children. The first program in this series was the principal responsibility of the Pittsburgh Foundation, and it really was outstanding. It featured John Woodrow Cox, a Washington Post reporter and the author of the book Children Under Fire, which reveals in very human and unforgettable ways that as stunning as the number of deaths are, there are other grievous harms caused by this crisis, including the serious mental and emotional toll that it is taking on children who have not themselves directly suffered any physical wounds. Still, let me return to the fatality numbers just for a moment to add some context, relying principally by a recent report of the Kaiser Family Foundation. Not only is the United States the only country among the world's similarly large and wealthy countries in which firearms have become the leading cause of death among children and teens, but firearms are not in the top 4 causes of death in any of the other countries. Comparing the U.S. with the other countries in this peer group, the U.S. accounts for 97% of the total child and teen gun violence deaths, despite being less than 50% of the total population. Put in absolute numbers, in 2020, the last year for which complete data is available, just 153 of these deaths, from a total of 4,510, came from the other 11 countries. All the rest, 4,357 deaths, occurred in this country. And we're not only doing poorly when compared to other countries, we're doing poorly compared to ourselves. The Pew Research Center has just reported that gun deaths have driven an historic spike in child mortality rates in this country. In fact, it is the biggest increase in a half-century. National examples underscoring these terrible trends keep coming our way almost too fast for us to catalog them in our minds. It's hard to believe that it was less than a year ago that 19 children were killed in the attack on the school in Uvalde, Texas. Far more recently, 3 9-year-olds were killed in an attack on a Presbyterian elementary school in Nashville. And just last weekend, 15 teens were shot, 4 fatally, at a Sweet 16 party in Alabama. Of course, this is not just a national problem. It is also a Southwestern Pennsylvania problem. 1 year ago today, our hometown headlines included the following: multiple shooters suspected in war scene that killed 2, injured 8 on Pittsburgh's north side. Each of the 2 people killed was 17 years old. Consider some of the other headlines dealing with tragedies that have occurred right here and in the relatively recent past. Toddler fatally shot in Pittsburgh drive-by. 4-year-old girl killed. Woman critically injured in shooting in Pittsburgh neighborhood. Mother and 7-year-old daughter found shot dead in Swissvale apartment. 4-year-old dies after accidentally shooting himself in Pittsburgh. And 5-year-old shot and killed by 6-year-old sibling in Penn Hill's home. Our presence here tonight suggests that no one in this room is prepared to accept this as the inevitable condition of life in America in the 21st century. Instead, we have come together to learn more, both about the problem itself and about what might be effective responses to it. Our program tonight is built around 2 outstanding keynote speakers who have traveled from California to be with us, and a really outstanding local panel. So let me invite Samantha Balbier to come to the podium and introduce our first speaker. And again, I'd be glad to see you anytime, any place, but it's particularly nice to see you here tonight as we address this really critical problem. Thank you for being here.
Good evening, everyone. Thank you for being here. As a mom, I can't frankly believe that I'm at the Children's Museum right now delivering remarks or introducing speakers on the topic of gun violence when I've spent countless hours here with my 2 children. We're very grateful for the Children's Museum for offering their space and their team's time and helping us plan this event. And so I just wanted to call that out one more time and say thank you for being a place in our community where children can thrive, and thanks for the time and giving us this space. So it's my distinct pleasure to introduce Dr. Moira Szilagyi. I'm going to read you her bio, and then I'm going to tell you some really fantastic things about her. The first is she's a primary care pediatrician, educator, and professor of pediatrics at UCLA since 2014, where she is the division chief of developmental behavioral pediatrics and the Peter Shapiro Term Chair for the promotion of child developmental and behavioral health. She's completed her MD, PhD, and pediatric residency at the University of Rochester, and during her 30 years in Rochester, she developed a community-based integrated care medical home for children in foster care, worked in a suburban private practice, precepted residence and continuity clinic, and created and led a regional child abuse program, conducted research highlighting vulnerable children, and mentored trainees. She's worked very closely with the American Academy of Pediatrics for 3 decades. In the 1990s, she led a multidisciplinary team at the AAP District 2, New York State, that developed the first healthcare standards for children in foster care, called Fostering Health, which is now the national standards. She served in leadership roles on the AAP's Committee on Early Childhood, Task Force on Foster Care, and the Council on Foster Care, Adoption, and Kinship Care. She's authored several AAP policy statements, clinical and technical reports, and speaks widely about child welfare. She's a very dedicated advocate. What you don't see in her bio is that she provided testimony to the Senate Judiciary Committee on June 15th, 2022, following the May 24th Uvalde shooting in Texas. The testimony was entitled Protecting America's Children from Gun Violence. Not only was Dr. Szilagyi's testimony exceedingly powerful through her heartfelt delivery, but she also invited pediatricians to provide their stories and their inputs about the impact of gun violence on their patients and their families. On June 23rd, following this testimony, Congress passed the bipartisan legislation called the Safer Communities Act the first major gun safety legislation passed in nearly 30 years. While progress still has to be made, we all see in the news much work still needs to be done. We all want to acknowledge there's no single solution to this epidemic of gun violence, but we're really happy and very proud that we have an advocate like Dr. Szilagyi to work on it with all of us. It's my honor to introduce Dr. Szilagyi.
Good evening, everybody. It's truly an honor to be here. When the invitation came, I really couldn't say no. And I want to thank those who sponsor this, those who lent this beautiful venue, and those who are partnering together on an issue that really should have every adult in America up in arms on behalf of our children. So I thank you for this, and as the intro slide said, gun violence is an epidemic in America, and it's an epidemic for our children. And we know that, as Chancellor Nordenberg mentioned, that just in the last 2 or 3 weeks, we've lost the lives of other children to gun violence in Nashville, in Dadeville, in Alabama, and Louisville. So intentional shootings, death by suicide, and accidental shootings kill about 3,600 children in America on average every year. And gun violence, as already noted, became the leading cause of death in 2020 in America. More than motor vehicle accidents, more than any other form of accident, more than the 20 leading medical causes of death in children. It's one of the reasons that we pediatricians have to stand up and speak. This is the leading health problem for America's children at this point in time. And as already noted, this does not count those children who are physically injured and survive or psychologically suffering as a result of this trauma. We know how to fix things in America. We did it for motor vehicle accidents. If you look at the curve for motor vehicle accidents, it's plummeted over the last 40 or 50 years. And we did that by taking a multi-pronged approach to what was a pretty complicated problem, although not nearly as complex as gun violence. And we did it by making safer cars, building safer roads, requiring people to get licensed prior to being able to drive by themselves. We also had kids strapped into car seats and seat belts. I wasn't as a child. I worry about that now, but in retrospect. So we took a multi-pronged approach to that. And at the AAP, we really think that this is the exact same thing that we have to do about gun violence. It's a complex problem. There's no simple solution. No matter what the sound bites say, we aren't going to get there if that's what we do. I don't really have any disclosures except for this one. I've been exposed to gun violence in my personal and my professional lives, in childhood and adolescence, and in adulthood, as an employee and as the mother of a police officer. As a teen, 3 of the boys that I grew up with died by suicide with a firearm. My brother's closest friend was killed in our home by his cousin with a handgun. As an adult, I was a waitress, and my 32-year-old boss was killed in the process of a burglary in our restaurant. As a pediatric resident, I took care of 5 children who died or sustained life-altering injuries. A 2-year-old who found a loaded and unlocked gun underneath the couch and shot himself. He did not survive. A 14-year-old girl was playing Russian roulette with her boyfriend with what they thought was an unloaded gun. Shot her through the spine. She's a paraplegic. A 14-year-old and his friend fooling around what they thought was an unlocked gun at the friend's house. the friend fired, nicked the aorta of his friend, his best friend. He died on the table in front of me because we could not stop the bleeding. And 2 other kids who have life-altering injuries. And then my son was a police officer up in Seattle. And he was the leader of a squad in which the Rocky was shot during a routine traffic stop for a car without a license plate just a few years ago. So, the sun has come up. This is my idea of a spotlight. So I'm not really going to spend any time on this slide, just to say that right now the highest rates in our population are for our Indigenous and our Black children and youth. And then I just want to spend a little bit time on this more recent data from the CDC, especially on the percentage of deaths. Most deaths in this country of children are related to assault, so they're violence related. That's about 73%. 24%, give or take, are due to suicide by firearm. Most of those guns are from the individual's own home. And then the 3% is the rest, unintentional or in some cases just unknown. So about 3,600 children die annually. About 15,000 more children are wounded, and some of those wounds are for life. Some kids recover from theirs, at least from the physical wounds. And it's estimated that about 3 million children annually, not total, annually, have direct exposure in some way, shape, or form. They witness the violence. They have friends, close family members, neighbors. And if you think about it today, I see it in my daughter's children. They were afraid to go back to school after Uvalde last year. And they go to a very nice school in a nice neighborhood. But I think the recent shootings have told us nobody is really safe. So so during the pandemic, this is Pew Research Center, the deaths of kids by firearms actually increased. One might have thought, with the isolation, not going to school, that maybe they would level out or decrease. But they actually went up from 1,732 in 2019 to 2,530, I think, or 90. I can't quite read that number. Thank you to the spotlight. And this one tells us that Black children are about 5 times as likely as white kids to die from gunfire. And they die for different reasons or different ends of the spectrum. Gun deaths in whites are usually suicides, while those in Black children are most often from assault or episodes of violence. It doesn't make them any less important. We have to pay attention to all of them if we're going to fix this. And then this is the graph that shows that top curve that came plummeting down. That's motor vehicle accidents in the United States. Look what we can do. Look what we can do to causes of death for children when we focus and pay attention and try to fix it. The line right beneath that, those are the gun deaths for children in the United States. And look what's happened to that. Not only have we not, a lot of us have been paying attention to it. Everyone in this room has been paying attention to it. Our government has not been paying enough attention to it. And that's really where we have to focus our energy. And you can see where those 2 lines crossed in 2020. And this is from Kaiser Family Foundation. Again, just showing over the last 4-year period from 2018 to 2021, the increase in the deaths of Black children from firearm-related injuries in particular, but also the higher rates among our Indigenous populations. And this is child suicide deaths, which you've probably been hearing a lot about. This is the second leading cause of death in children, and rates have been going up a lot, again, in black children, even though they're still higher in white children. I want you to look at that bottom curve. Those are 10 to 14-year-olds. So even though most of the deaths occur in the older children, they almost doubled between 2013 and 2018 in 10 to 14-year-olds. I once took care of a child who tried to die by suicide, who was 7 years old in the hospital. It's one of my patients, 7 years old. He knew where his family kept the gun. They didn't even know. They didn't even think he knew that they had a gun. And this slide just shows gun violence in Pennsylvania, where children and adults, about 1,500 people a year die. You rank 32nd in the rate of gun deaths in the country. And 62% of your deaths are by suicide, and 35% are homicides. And you look pretty much like, I think, the national average when we look at adults. Although I think my friend is going to give you probably better data. I want to spend a little time on this book, mostly because we have had far too many mass shootings lately. And I think especially given the recent tragedies. So the two authors of this, Doctors James Densley and Gillian Peterson, really did a forensic analysis of all the mass shootings in America between 1966 and 2018. It was a really detailed study. They interviewed hundreds of people, hundreds of experts, hundreds of people who had been through mass shootings. And I just want to share the results of this study because I actually think it has a lot to tell us. And inside of this, going backwards. It's a big problem that I have actually going backwards sometimes. So school shootings, to me, are the most horrific of all the mass shootings, although they're all horrific. They seem so random and so unpredictable. And they're so brutal and so destructive. They snuff out young lives before they've even had a chance to blossom or find their way. Parents never expect that they're going to say goodbye to their children in the morning and then never see them again. That they're going to hand them their backpacks, make sure they did their homework, make sure they had breakfast, and then never see them again. And the children who witness, they are forever changed. My son, whose rookie died in a horrific shooting, said to me a couple of months later, "There's life before John died, and there's life after John died. They're not the same life." And that's what happens to these children. There's life before a shooting. There's life after a shooting. It's not the same life. Parents who wrap themselves around their children and try to get them through these horrible tragedies know deep in their hearts they'll never be the same again based on what happened, although we hope that they do a lot of healing as long as they have those great adults in their lives. So school shooters, these authors found, were mostly white males, but not all of them. I think it was around 92%, if I remember. All were under 18 years of age until Uvalde, but the Uvalde shooter had just turned 18. He had actually just graduated from that high school. The Nashville, Tennessee shooter is 28, so that's very different from others. They also found when they looked at all mass shootings that had happened in the United States, there was an increase in frequency, deaths per incident, average number of deaths per year. And this also applies to school shootings since 1999. Does anybody remember what happened in 1999? Columbine. And Columbine was a game changer. Those shooters engaged in detailed planning. They wrote a long message about their intentions and reasons. That shooting was picked up and covered relentlessly. Anybody who was alive then will remember days and days and days. It might even have been weeks. It felt like weeks and months. By news venues, cable news, CNN was pretty new. Social media was pretty new in the form of Facebook. It was relentless. And Columbine has become the script for all subsequent school shooters. Oh, the other important thing they found is that there are 5 recurring themes that highly correlated with violence for all mass shooters, including the subset of school shooters. One is all of these shooters, every single one, had unaddressed childhood trauma, most often in the form of child abuse and neglect, sexual abuse, emotional abuse, and interpersonal violence, or severe. The authors use the word incessant bullying by their classmates. They were very isolated from their peers in general, with really limited supportive relationships in their lives. And many of them, by the time they reached adolescence, were suffering from depression, anxiety, and paranoia, which isn't a very common diagnosis in general. The second major thing was there's an identifiable crisis point shortly before the shooting, within days, weeks, or months. The Parkland High School shooter, for example, had the death of his mother a couple of months before, and then he was expelled from school shortly before. They also communicate their crisis to others, although it's often misinterpreted, misunderstood, or ignored. They might have a change in their behavior, their appearance, or their mood, or they might make a specific threat, often online. So I'm going to stop at 2 here, and then we'll pick up on 3, 4, and 5. So some of the signs and symptoms, this is very important for all of us pediatricians who are here today. We see these children. We meet families when they're just forming often, and we follow them sporadically or at least episodically throughout their child's life. Now, most individuals with risk factors like these, with a family violence and a history of child abuse or being bullied, or parents with substance use disorder, or gang involvement or history of violence, do not go on to do harm to anybody, including to themselves. But when we see that, what we know is a kid's in trouble and we need to get them some services. And then the second thing is this marked change in baseline behaviors. Increased agitation, aggression, and abusive behaviors. Increased isolation, becoming withdrawn, irritable, or depressed. Sleeping a lot more or sleeping a lot less. Decreased ability to actually function, which for most kids is completing your school tasks, right? And losing your sense of reality and becoming somewhat paranoid. And then this leaking of dangerous thoughts or ideas. It's the accumulation of trauma, the lack of supportive relationships and intervention, and the acute crisis that leads this balloon, which is ready to pop, to pop. At least that's the theory. So the third thing they found was this script that many of them are following from social media. They look at details about other mass shootings, particularly Columbine. They go onto online sites that radicalize toward violence. They model themselves after other shooters. There's a little bit of fame-seeking going on or a sense of I'm leaving a legacy. And they often have a detailed plan, but they don't have an escape plan. And so there is a theory, or a hypothesis at least, that they don't really plan to survive, that this is suicide by mass shooting. Number 4 on the list is someone to blame. All of these shooters blame their distress and their despair on other people or groups, and school shooters blame the school or the bullies that they encountered in school. And the 5th thing, it's really important, it's access. Access to guns, and access to the people and the places they blame, or people and places like them. So if we line up childhood trauma and an identifiable crisis, a script, someone or something to blame, and access to guns, and you think about it to any extent at all, you can start thinking that there are some pretty obvious solutions. One is that we need really sensible gun legislation in this country, and we need it very soon, if not immediately. We need good mental health services and some trauma-informed care. That may be a longer-term solution. And we probably need some guardrails on social media. Both social media and journalism have made some changes. They no longer glorify the victim or the shooter by mentioning them over and over, but they're really trying to focus on the victims now instead. So the American Academy of Pediatrics has a lot of partners in our advocacy. We have been advocating for sensible gun legislation for decades now. It's part of our injury prevention work that we do at the Academy. We work with the entire House of Medicine. We work with public health partners across the country. We work with Brady, Everytown, Giffords, and then we actually lead a coalition on gun violence prevention research roundtable. So our advocacy has been multi-pronged, similar to motor vehicle accidents, and really focused on harm reduction. While we support the rights of sensible, responsible, licensed, background-checked individuals to own a gun, we also support the rights of parents to live in safe communities and to expect their children to be safe and to grow up safe and healthy. So last year, as someone mentioned, Sam, shortly after Uvalde, I did have the privilege of testifying before the Senate Judiciary Committee. And I shared emails and letters from over 300 pediatricians from all over the country around their experiences, as she noted. We had a number of bills that we have been working on for years. We have a huge advocacy legislative office in DC, 22 people on the staff. They're always talking to the Congress. But a few weeks before me, even more important, I thought, was Dr. Jose Herrero. He was the only pediatrician in Uvalde. He's a primary care doc. He was called into the emergency room that day after the shooting happened. He lost 5 of his own patients that day. He gave what I think is some of the best testimony I've ever heard. He told them that he did his job every single day as a doctor to reduce the harm to children. And he told Congress, you are the country's doctors, and to please, please, please do your job to keep our children safe. So shortly after, Congress did manage to pass the first gun legislation in 30 years as the Bipartisan Safer Communities Act. The legislation banned those convicted of domestic abuse from owning a gun. It included background checks for buyers under 21 and funding to encourage states to implement red flag laws. I think that's still an issue here in Pennsylvania, is that right? And $15 billion in federal funding for mental health programs and school security upgrades, all of which we have supported and advocated for quite some years. There were a lot of years where no research on gun violence was done in our country. In about 1997, the Dickey Amendment to one of the budgets led to a 22-year ban on research into gun violence prevention. People now estimate that our infrastructure for research in that area is in an $80 million deficit, and that we need about $120 million a year to support adequate amount of research. We're nowhere near that. We're up to about $50 million a year split between CDC and NIH. Between 2008 and 2017, the federal spending per child death was about $600 for a gun death, $26,000 for a motor vehicle accident death, and close to $200,000 for each child death from cancer. And yet, gun violence was killing far more children. So as I said, the CDC and NIH are now sharing about $25 million. It's doubled, I think, just went into effect. And there was actually the National Institute of Justice for the first time secured $1 million of federal funding for research also. We still have things that we are working on. You know, we work with both sides of the aisle. We are also a nonpartisan nonprofit. And we have friends on both sides of the aisle. And we work with them on a lot of issues besides gun violence. So we are often trying to find those sweet spots and right times when we can move something forward. We think there should be universal background checks no matter where you buy your gun, and they should be rigorous background checks. A waiting period before your purchase can be completed. Standardized evidence-based training before you are licensed to purchase a firearm. A ban on all assault weapons and high-velocity magazines. And increased federal funds for research on gun violence. One opportunity that we've been looking at is that guns are consumer products, but they're exempt from legislation. So the Consumer Product Safety Commission, which regulates a whole lot of stuff, inclined sleepers for babies and toys and all sorts of stuff, they do not regulate guns. So we actually think that this is a manufacturer thing, that guns should be regulated for the safety of their designs, for such things as prevent firing by an unauthorized user. And then our chapters are very active. Here in Pennsylvania recently, there's been advocacy around universal background checks, safe storage requirements, red flag laws, and then a ban on assault weapons. And this is a picture of some of our AAP chapter Pennsylvania pediatricians who were just at your legislature in Harrisburg testifying in March of this year. And one of the things that we pediatricians try to do is to educate families about safe storage and having guns. The safest gun, of course, is no gun in the home. But if you're going to have a gun, then how do you do that safely? In 2011, Florida banned doctors from teaching families about gun safety. And they made doctors subject to a $10,000 fine and loss of their medical license if they did engage in anticipatory guidance, as we call it, around this topic. It took 6 years, but it was eventually overturned by the Court of Appeals on free speech rights. So what are these awful things that pediatricians say to families about guns? We do recommend keeping guns outside of the homes when there are children under the age of 18, and there are gun ranges that offer storage, gun clubs, some police departments offer safe gun storage for that. If you're going to have a gun at home, you all know this drill. It's unloaded, it's locked, and the ammunition is locked up separately. We also have to address parents' beliefs. Parents have a rather inflated sense of their child's behavior around guns in terms of thinking about how safe they are. But children are curious, and they don't have 9 lives. They also don't ask about firearms where their children visit for sleepovers and play dates. But it's really important to know if the family where your child is spending time has a gun. 2 of the kids who died in my presence the gun was from the friend's house. And then, so asking saves kids. That's ask about families where firearms where children are visiting. And then lethal means counseling. This is if you have a child with some of those risk factors, child who's depressed, suicidal, substance using, being bullied. This is when we really counsel very heavily that the safest gun is no gun in the house and to find an alternative place to store that gun. So even with all of that, that bottom line in the table, for homes with children less than 18 years in the home, 5% of families have an unlocked and loaded gun in their homes. 5%. So moving on to solution number 2, I'm actually going to go a little bit through each of these. So this is mental health and trauma-informed care, where we actually have some bipartisan agreement. So trauma and gun violence, there's kind of 2 pieces to trauma, right? There's the survivors and witnesses of gun violence who will live with that trauma forever. But trauma has been identified as a cause of gun violence in those with high rates of child abuse, bullying, and so on. So it's really becoming clear that childhood trauma permeates the lives of so many who resort to violence and who die by suicide. So what do we know about childhood trauma? We actually know a lot. We know that biological stress response system of children who are exposed to significant or ongoing or frequent trauma in the absence of protective relationships become dysregulated. And when they become dysregulated, they lead to changes in our bodies, but more importantly, to changes in our brains. The brain's alarm system becomes turned up, and you may see danger where none exist. The thinking and learning structures and those that help us regulate our emotions and our behaviors don't function as well as they should. So we've set a child's brain up not to do well. And we now know this is our response to threat. You're all probably familiar with a fight, flight, or freeze response. This is a very primitive response. We all have it. Our body senses danger. The first thing that happens, well, it's actually the second thing that happens is that our amygdala, body's alarm system, goes bang, danger, and we start secreting hormones like adrenaline and cortisol, which prepare us to fight, flight, or flee so that we can survive. And the system's designed to shut itself down after about 20 minutes. So you've either been eaten by the tiger, or you've escaped, or you've climbed a tree, or somehow gotten yourself out of it. But what happens when children are exposed to danger over and over again, when the system becomes dysregulated, is that, especially in the absence of nurturing caregiving, the threat system is on high alert. You start seeing danger where none exists. You don't read cues as well. You don't read people as well. But the good news is that we also know the biology of relationships. This is the fourth stress response that I certainly didn't learn about in medical school. The first thing that happens when, within a decasecond, like so fast, like faster than I can say a word, is that the amygdala, the alarm system, goes, whoop, better secrete some oxytocin. Oxytocin's the relationship hormone. And if that child looks around and does not see a nurturing caregiver, often to fight or flight, that fires off that system. But if that child looks around and sees a caring, safe, protective adult, then what happens is oxytocin activates the affiliate network in the brain. That's all these structures that store memory and help you think and learn and help you regulate your emotions and your behaviors. The affiliate network, it's a real thing. And that is how relationships help us to help children avoid these terrible outcomes from a lot of cumulative trauma and adverse experience. Turns out the best treatment for stress, any stress, in children's, teens, or adults, is having safe, nurturing relationships for all of us to rely on. So the AAP is strongly in support of the Rise from Trauma Act, which is sitting in the Senate. It's bipartisan. It expands trauma-informed workforce in a number of settings. It provides training for us healthcare workers, but also for teachers and first responders and community leaders. And it creates 2 new grant programs through HHS to support communities and hospitals in providing trauma-informed services. And then crisis intervention is something else we talk about a lot. This is really trauma-informed care. It's one type of it. This is how we let some air out of that balloon that's ready to pop when we recognize that children are suffering. A trained team knows how to respond by doing rapid de-escalation and triage. They recognize that crises are dynamic situations, and you've got to have a trained team because untrained people can do more harm than good. You've got to watch the safety of everybody who's present, children, staff, and others. You've got to focus very much on the needs of a child or teen in crisis, which means you've got to assign the right person on your team to that person. And you've got to establish a trusting relationship with them. Sometimes you're doing that in the moment. Sometimes you already have one with them, if you set up your school right, for example. The last thing you want to be is punitive, because where does punitive send you in your brain? Fight or flight. You are gone. And that is not going to calm anybody down. It's not going to calm a child down. It's not going to calm an adult down. So local teams are the best because they know their community, and there's some ideas about who should be on a team at school. They need to know how to identify and triage threats. They need to have a communication plan because things go sideways in a crisis very fast otherwise. They have to know what their local resources are and maybe where some of their gaps are. Everybody has to have education and training on crisis intervention and suicide prevention, and avoid punitive approaches. This is another thing that's working, the P3 Campus app, which was designed by some Sandy Hook families through Sandy Hook Promise. It went online in 2018. It's an anonymous tip reporting system for mental health or threats. They found anonymity increased reporting, so they favor that. It's available every day of the year, all day long and all night long. And it's staffed by counselors who have training in both suicide prevention and crisis intervention. And they handle dozens of threats a day. Think about that, dozens of threats a day. 1 to 3 at a time usually for their average counselor, sometimes up to 5. But it lets some air out of the balloon. Safe schools. This is a balance between promoting physical and psychological safety. I remember being very upset when they put a metal detector in my daughter's high school 20 years ago. But they assigned a local police officer. He was great. He knew all the kids by name. It was, "Hi, how are you?" And they would laugh, and he'd go, "Oh, let me just look in that backpack." It became just kind of like a fun moment. They began the school with officer, I don't remember his name anymore, I think it was Tom. There's also been some work looking at lockdown drills. There was one study of 166 schools with and without lockdown drills, showed no changes in outcomes. I don't remember what they were measuring. Children report an increased sense of preparedness, but especially the younger children feel less safe after a lockdown drill. They're more anxious and more terrified. So the recommendation that came out of this, and I think other studies, has been lockdown drills, if you're going to do them, you should do them with staff, school personnel, and maybe older youth in a kind of a balanced way, because they create too much psychological distress for the younger children. And school hardening, which you might have heard a bit about, such as arming teachers in the classroom, there's just no evidence that I know of that it works. And then we are busy trying to address the crisis in children's mental health. We declared a crisis 2 years ago, and we're working very hard to increase the skills of our pediatricians about trauma-informed care and mental health, because there are not enough mental health workers in our country, and we certainly don't have enough workers who are trained in trauma-informed care, which there's evidence-based trauma-informed mental health interventions. So we have published a lot of stuff on trauma-informed care and trauma-informed systems. We also have a course on trauma-informed care, which is really relational health. It's very positive resilience building. We have done a lot of work on youth suicide prevention, this blueprint for youth suicide prevention, which was a partnership with the American Foundation of Suicide Prevention and the National Institute of Mental Health, was published in 2021. And it's really not just designed for pediatricians, but it's actually designed to be used wherever children are, in your community, rec centers, libraries, football fields, schools, and in the doctor's office and health settings. And it's got a lot of information on it on upstream, how communities can work on upstream factors, as well as responding in an urgent crisis. We're also giving out small grants. We just gave out our first round of grants to 20 AAP chapters and 13 community health departments to actually start implementing things in this plan. We also strongly supported we've always had a suicide lifeline. It was actually called Lifeline back in the day. Now everybody's just calling this 988. And the first year they started, which was about 20 years ago, I think in 2005, they had 50,000 calls the first year, 2.5 million a few years ago. So problems have escalated. Callers can call or text 988. It's a lot easier to remember than the old 10-digit number. And the studies that have come out of this have shown that callers feel less suicidal, less depressed, less overwhelmed, and more hopeful after they speak with these trained counselors. And that's available 24/7, every day of the year. This is Sandy Chung, our current president. We've been busy testifying in Congress and had some real success. Since there aren't enough pediatricians who are experts in mental health, and there aren't enough mental health people, in particular child psychiatrists in the country, we were particularly interested in the Pediatric Mental Health Care Access Program, which last year is now funded so it can be operated in all states and territories in the United States. And this is a wonderful program because it provides psychiatric consultation by phone to a pediatrician who might be standing in their office with a child that they're deeply concerned about and don't know what to do with. So you'll get a call back within an hour or two, and I've used it a couple of times in my long career. It was very helpful. And then we also got a grant from the CDC for a National Center for Relational Health and Trauma-Informed Care, which I'm really excited about. And then we're got some more funding to implement the suicide prevention stuff. We also lead the Child and Adolescent Mental Health Coalition of 30 partners, and those partners are not just health partners, they are from across the spectrum. They're from schools, they're from suicide prevention. They bring a really wonderful set of diverse viewpoints to our work. We have done actually some of our best advocacy around mental health and trauma-informed care and gun violence prevention with them. And I really can't leave the issue of gun violence without mentioning media and children. If we look at the increase in suicides, gun violence, and mental health problems in children, those curves, which go up, maybe go up that way from your viewpoint, really parallels the growth in their exposure to social media. And what we know about social media is they have not been self-policing. They don't really have any guardrails that make social media a safe ecosystem for our children to be spending time in. And so what you can say when you look at curves like that is it looks like there might be a relationship, right? But we can't prove cause and effect. But we have started working very hard. So we just in March, a whole bunch of us were in DC. We had 320 pediatricians from 46 states. And we met with all of our the legislators who would meet with us, which was not everybody. Some people ran in the other direction, apparently, when they saw one of our groups coming. And it was really about passing online privacy design and safety protections to really create a safe digital system, because kids are so far ahead of their parents when it comes to this stuff that it's almost impossible for parents to monitor. And this happens to be a bipartisan issue. So this is another good one. And so anybody who's interested, we welcome you. So there are a lot of reasonable preventive solutions. And you probably could come up with a whole bunch more than I can. I think the challenge is that there are competing interests that really stand in the way of the safety and the well-being of our children. My father was a bricklayer. He would have actually really loved this room, by the way. He would have also said, your bricks need some pointing up. So a word to the museum directors. But he taught me, even as a little kid, that you build a safe home one brick at a time, and you layer up a row at a time on a steady foundation to make sure that the home is sturdy and complete. And that's how advocacy is. Sometimes it's a brick at a time. If you get really lucky, you can do a whole row. Last year was a good year for advocacy for children. But we still got a lot of stuff to do. But the thing is to persist and to take a multi-pronged, evidence-based or informed approach, working across systems, as you're doing here, and aisles wherever possible. Because our children really, and their futures, the children of today really cannot wait. They are in jeopardy. So I thank you for your time and attention.
Yeah. Thank you very much, Dr. Szilagyi. And I will say that we've had scores of distinguished speakers here before, but never in my experience has Mother Nature put one of them in the spotlight. So yeah, you sit on a pedestal all of your own now. And I think what we're going to do, because we've seen how compatible the two keynote speakers are, is I'm going to have Samantha come back up and introduce our second speaker, and then we'll take some time for questions and answers at the end of that address. Thank you again.
Hi, everyone. Thank you, Dr. Szilagyi. So I want to introduce our next speaker, Dr. Rosanna Smart. You may recall Dr. Szilagyi mentioned that in the passage of the 1996 Dickey Amendment, effectively all gun research, federally funded gun violence research dried up, leaving a void in the evidence-based policy development that may have prevented the public health crisis that we find ourselves in today. And what I want to do is call attention to the Rand Corporation, who said enough is enough of not having data around the issue of gun violence prevention and gun policy. So in March of 2008, the Rand Corporation took it upon themselves to raise the funding that was necessary to launch a national research initiative to fill this data void. And that initiative is called the Rand Gun Policy in America Research Initiative. And with us today is Dr. Rosanna Smart, who is the co-director of that initiative. She is a leading researcher with the Rand Corporation, and she aims to understand conclusively the determinants of gun violence and how quality improvements in gun violence research can lead to life-saving innovation. Dr. Rosanna Smart is also an economist at the Rand Corporation. She's co-director also of the Drug Policy Research Center and an affiliate of the faculty of the Pardee Rand Graduate School. Her research is in applied microeconomics with a focus on issues related to health behaviors, illicit markets, drug policy, and the determinants of gun violence. Welcome, Dr. Smart.
Gosh. Thank you so much, and thank you all for being here. It's interesting. I believe all three of our speakers, Chancellor Nordenberg, Dr. Szilagyi, and I, are presenting the same data in this chart, but the trends are so striking. It's hard not to. And I spend my career, I'm a researcher. I'm coming from that perspective. I'm not on the front lines. I'm not in advocacy. I spend my time looking at these statistics. But for me, on a personal level, they've carried new weight since last year because I became a mom. And so when I received the invitation to come here and speak at this event, I abandoned my child at home with my husband. No. It's painful for me to even think about him being represented in this chart. And I cannot, it's so clear, I cannot even imagine what it must feel like to get a call from your school that it's in lockdown, or to sit at the side of your child's hospital bed, or to be the doctor who is working on that child. It is scary to think of my child, who turned 11 months old yesterday, happy birthday, Beckett, growing up in a world where these are the trends. And I think the American public, and especially America's youth, recognize this is a big problem. Gun violence is a huge problem in the US, and they are demanding solutions. Unfortunately, gun violence is also a very complex problem, in part because it's not really just one gun violence problem that America has. We have several. We have mass public shootings, suicides, family violence, community violence, accidents. These different forms of gun violence are not distributed evenly across populations or across communities. They involve different sources of risk and consideration and thus probably necessitate different policy solutions. This complexity really creates challenges in trying to identify, develop, and evaluate interventions that could help address the problem. And these challenges are seriously exacerbated by the politicized and polarizing nature of the topic, which, as we've heard for decades, has hindered federal and private investment in the area. So it was in this context, a complex and important problem in which we were underinvesting, that then President of RAND, Michael Rich, launched the Gun Policy in America initiative. The overarching goal of the initiative was to leverage RAND's role as a nonpartisan, nonprofit research organization in order to fill the relative gap in rigorous and objective research and analysis on gun policy in the United States. The initiative was initially supported by internal RAND funds, but since 2018 has been supported by Arnold Ventures. I now serve as co-director of the Gun Policy in America initiative with Andrew Morrell, but it's really a large team. It involves researchers across a wide number of disciplines, but also a kind of large-scale communications team with communications analysts and web developers. In its initial form, this initiative was designed to be web first. We really wanted to make sure we got our findings out there and we kind of portrayed the evidence in a way that was usable to a number of people in the public, to policymakers, and to the media. As we've expanded our work to look not just at what gun policies work, but for whom, so thinking about different communities, we've also extended our teams to include the perspectives of community leaders and community members, particularly those in communities disproportionately affected by gun violence or by the enforcement of gun laws. So our kind of overarching aims are threefold. One is to provide the public and policymakers with an assessment of the scientific literature, the rigorous scientific literature on what are the effects of various gun policies. And our focus has primarily been on state gun policies, though we've done some work on the community intervention side. Where evidence is thin, we aim to help fill those gaps through our own original empirical research, but also through the development of tools, data sets, and methodological resources to help improve data and research in the field more broadly. So today, I'm gonna do a brief kind of history lesson or background on kind of why it's difficult to kind of estimate the effects of kind of state gun policies and community gun policies in particular, why it's hard to get rigorous evidence in those spaces, and the importance of investing in data and research to answer them. Then I'll talk about what we found kind of based on our own work and in reviewing the evidence more broadly on what are effective state policies for addressing gun violence. Touch briefly on effective community interventions, and then I want to conclude by thinking about where do we go in terms of policy and research in light of the recent Supreme Court decision in Bruin. So gun violence is important. And we want solutions now, but it is important, particularly in this context where we have limited political capital and limited resources, to get things right. And so to the extent that we can, we really want to draw on evidence-based solutions. And when we think about evidence-based solutions from a state or a community policy context, we really need to understand what are the causal effects of these policies on gun violence or other outcomes that we want to address. So typically, when we think about causal evidence, the ideal scientific design is a randomized control trial. We take a group of individuals or a group of clusters, and we randomize some to receive the intervention, and the others we randomize not to receive the intervention. Then we compare outcomes between them, and that gives us the causal effect of the intervention. It's typically not possible to do this in the context of state or community policy. Given our political structure in the US, we're not just gonna randomly assign policies to states, as much as I keep asking. And from the perspective of a community intervention, we often, for resource reasons or ethical fairness reasons, we need to deploy those interventions where they're needed most. We can't just randomly assign it to one community or another. We don't have the resources to do that, or we don't have the time. We can't wait to do that. So if we can't get experimental evidence, we try to get rigorous evidence from quasi-experimental research designs. And here the idea is we use statistical methods to try to approximate a randomized control trial. And what we want here, kind of at a minimum, are two things. pre-intervention or pre-policy data and post-policy data to ensure that the intervention preceded any effects that we then want to attribute to it. And really what we need is a good comparison group. So if we have a state that has a policy, we need a good comparison group to tell us what would have happened in that state had the policy not been put into effect, right? That's our typical control group in a randomized control trial. And to get both of these things, we need reliable, comparable data over time for different groups, for different states or for different communities, some of which were exposed to the policy and some of which weren't. Ideally, we can measure the full scope of outcomes of interest, mortality, non-fatal gun shootings, trauma, perceptions of safety. Ideally, we have a whole range of outcomes that we think might be affected. We also might want rich data to explain some differences between our comparison and our treated units, right? We don't have that randomization. There's likely to be some differences even if we get as good a comparison group as we can, and so we want to statistically adjust for potential differences in, let's say, economics or pre-existing rates of gun ownership, again, in order to be able to attribute any changes we observe in the place with the policy to that policy itself. High-quality data are useful for these kind of causal inference questions, but they also support kind of the rich descriptive and epidemiological type research that helps us understand the scope of the problem. Where are the harms concentrated? What are risk factors at the individual level? Again, data is useful for more than just causal inference questions, but it's particularly key there. As Dr. Szilagyi and Sam mentioned, unfortunately, we're kind of behind. We're coming from behind. We're playing catch up in terms of our data infrastructure to study these questions. It's not because we didn't know gun violence was a problem. It's because there was kind of political action that took place that hindered federal investment. So in the early 1990s, there were federal efforts to begin to address gun violence as a public health issue, and CDC actually began a program of research and started piloting the feasibility of getting data on non-fatal firearm injury. In 1996, Congress added a provision to the spending bill that allocated funding to the CDC, saying that CDC funds cannot be used to advocate or promote gun control. This is commonly referred to as the Dickey Amendment, after the spearheader, representative from Arkansas, representative from Congress, Jay Dickey, who was the self-appointed point man in Washington for the NRA. And while this language doesn't actually technically prohibit the CDC from funding gun violence research, it prohibits advocating or promoting gun control, it had a complete chilling effect. You'll see 1 year later, CDC shut down its pilot of this non-fatal firearm injury surveillance. We still today do not have a national surveillance system for non-fatal firearm injury, and we can't even get reliable kind of state-level estimates of firearm injury hospitalizations and emergency departments visits over time on any sort of timely basis. In 2004 also marked the last year that CDC's flagship, this huge behavioral risk factor surveillance system survey, their flagship behavioral health survey, which asks about fruit consumption and seatbelt use, and in some states about indoor tanning, which is fun, used to ask questions about gun ownership and storage behaviors. They removed these questions after the 2004 survey, so they are no longer part of the core module. Some lesser-known amendments that restrict our ability to study gun violence are the TIARD amendments that were passed originally in 2003, and then a couple more restrictions were layered on after that. These, among other things, restrict the use and sharing of crime gun trace data. So when a gun is recovered at a crime, it's traced back to kind of its original legal source. These data used to be used by researchers to really try to understand illegal gun markets. The TIARD amendments restricted that. These data could no longer be shared with researchers. We started to maybe see some progress toward expanding our data infrastructure in 2008. Congress did loosen some of the TIARD restrictions, so now aggregate statistical data on crime guns are made available. And after the Sandy Hook shooting, President Obama urged Congress to allocate dedicated gun violence prevention research funding to CDC, but Congress denied this request. So the end result of this, as Dr. Szilagyi said, is our federal funding on gun violence prevention is just paltry compared to what we would expect it to be given its role in mortality. That's not even counting kind of its role in trauma. And this really does serve to hinder both the data infrastructure we have. We just are very bad at measuring pretty much anything except gun deaths at this point, but also kind of research questions that require resource-intensive data collection. So anything that requires linking administrative data sets from healthcare to criminal justice, which may give us a better sense of the picture. Longitudinal data collection on individuals over time to understand how exposure to gun violence might affect later subsequent life trajectories. Those are really expensive research endeavors to do at scale, and the absence of federal funding has really hindered that. So research continued during this time. You know, there were dedicated researchers, private foundations, no, I'm okay, thank you, did pick up the slack, but these kind of large-scale projects were not feasible to do. Now, there has been a recent resurgence in funding. In 2018, with seed money from Arnold Ventures, the National Collaborative on Gun Violence Research was established. This is a consortium of donors who fund private donors who fund gun violence and gun policy research. Thus far, the collaborative has funded $22 million in grants for 51 research projects. We have resumed federal funding, $25 million annually, split between NIH and CDC, starting in late 2019, and that's been approved annually since. And these are helping spur research, but it's also helping establish a growing community of gun violence researchers. So last November, the RAND helped organize the first National Research Conference on Firearm Injury Prevention, which attracted, I think, 600 registrants, 300 scientific presentations, co-sponsorship from federal agencies, and actually led to the launching of a professional society on firearm injury research that is going to organize this moving forward. So I think this year's is in November in Chicago. The funding is also kind of coinciding with more rigorous research and data infrastructure development. So just to flag a few things, the National Violent Death Reporting System, which collects really, really detailed information on all violent deaths, including all fatal firearm injuries, and it kind of compiles information from law enforcement, medical examiners, toxicology reports. So it has really rich information on the circumstances around the death. It's how we know that kids who die from guns, where they got their guns. It comes from data like this. This is now fully funded in all 50 states, DC, and Puerto Rico. CDC has also made efforts to make aggregate mortality data available on a more timely basis. So it's now running at about a 6-month lag for provisional data versus the 2 years we used to have to wait to know what was going on with deaths in the country. And CDC has resumed kind of a non-fatal injury surveillance pilot program. So this faster syndromic surveillance pilot is funding health departments in 10 jurisdictions to see about getting near real-time data on emergency room visits for firearm injury. There's also been a really increased funding to study community interventions. So NIH now has a research network funding various projects in various cities that are focused on community interventions that might reduce firearm violence. And these are housed under a research coordinating center to try to kind of harmonize data collection so they can draw on insights from one another. And then Arnold Ventures has funded the Violence Reduction Center at University of Maryland, which aims to kind of identify best practices and evidence-based community violence interventions, and then disseminate that and work with local city leaders to help kind of implement those in their particular context. We also have a growing evidence base where we're finally starting to get some rigorous evidence around what are effective state and community policies to reduce gun violence. So I'll focus here on kind of, again, more rigorous quasi-experimental studies and the evidence they provide for the effects of various state policies. I'm not going to cover every single state policy with evidence, but I'll focus on those for which I think we have kind of the stronger and more robust quasi-experimental evidence, and those that might be more relevant for youth. So some of the strongest evidence, and this has been true kind of since the launch of the Gun Policy in America initiative, where we've been kind of continuously reviewing the scientific literature on state policies and their effects. Child access prevention laws have relatively strong evidence that they're effective in reducing a wide range of injury types among youth. So not just unintentional firearm injuries and deaths, but also firearm suicides and firearm homicides. There's also some evidence that these laws have broader effects, and they may actually reduce firearm deaths among adults. And one interesting thing we found in a survey of kind of experts and advocates across the ideological spectrum was there's generally kind of broad support, at least they're not viewed disfavorably, even by people who self-align more with the NRA or more permissive gun policies. But there is kind of some growing qualitative research that finds gun owners may view kind of requirements around safe storage. Sorry, I should clarify. Child access prevention laws impose penalties on gun owners who store their guns in a way that allows access by a minor, just in case people don't live in my head in this room. So some gun owners view these kind of secure storage requirements negatively, often because they feel that having to store their gun in a secure way would limit their ability to use that gun defensively, so should someone break into their home. But we do know that secure storage matters for youth, and Dr. Szilagyi has touched on this, though I think we might be looking at different studies because our numbers are slightly different, but I think yours might be more up to date. But as of April 2021, based on this study by Miller and Azriel, approximately 30 million children lived in households with firearms. Just over 1/3 of those households stored at least one gun unlocked, and 15% stored at least one gun both unlocked and loaded. And this matters for adolescent access. So there's a kind of very cool survey that was done with parent-adolescent dyads, where they asked the parents about how they stored the guns, and then they asked the adolescents how quickly could they access that gun. And they found that in households where parents owned a gun, about 1/3 of adolescents aged 13 to 17 said that they could access a loaded gun in less than 5 minutes. In households where parents said at least one gun was stored loaded and unlocked, it's more like 50% or 60% of adolescents said that they could access a loaded gun in less than 5 minutes, which is twice the rate of what adolescents said in homes where all guns were stored unloaded and locked. We also found relatively strong evidence of perverse effects, so that shall issue concealed carry laws, so more permissive concealed carry laws where law enforcement don't have discretion in who they grant concealed carry permits to, are associated with increases in total and firearm homicides. And I was trying to think through implications for youth here, and I think there's some interesting implications that some of the potential mechanisms by which these laws may increase violence are kind of related to secure storage. So there's evidence that shall issue concealed carry laws, kind of moving from a more restrictive to a less restrictive concealed carry regime, increases purchasing of firearms, particularly of handguns, and those states have higher carrying rates. So there's maybe greater gun availability just in the community that may affect adolescents. And there's a recent study that finds actually that moving from a more restrictive regime to shall issue concealed carry actually increases gun thefts by, I think, around 35%. And those gun thefts may end up kind of leading to more adolescent access, either through illegal markets or if the adolescents themselves are stealing the guns. And I think it's also important to think about this in the context of recent evidence that guns stolen from vehicles have actually become the nation's largest source of stolen firearms. And so thinking through, I think, policies, if we are in a regime, and we are all in a regime now, where shall issue concealed carry laws are the law of the land, given Bruin, thinking through kind of ways that we might reduce potential harms through reducing the theft of guns, either from homes, but also thinking about secure storage outside of the home in vehicles, and how can we incentivize secure storage in vehicles as well as homes. We also found moderate evidence, so this is a little bit less robust, but still kind of higher quality, more rigorous evidence that minimum age requirements, so raising the minimum age at which one can purchase a firearm can reduce firearm suicides among youth, and that domestic violence restraining order prohibitions, particularly if they are combined with laws requiring the surrender of existing firearms, can reduce intimate partner homicide, which again, if we are thinking about trauma and family violence, is incredibly important for youth. So again, the focus of the Gun Policy in America initiative has largely been on state policies, but I do want to touch on some kind of cool studies of community interventions. So we know that place shapes crime. There's decades and decades of research showing this. And we actually have kind of experimental and quasi-experimental evidence on the role that cleaning and greening and kind of improving green space in a community can reduce crime and can reduce gun violence in particular. And so this is from a very cool randomized control trial by Charlie Bronas and colleagues done in Philadelphia, actually, where they randomized certain vacant lots to be cleaned and greened, and then others not, and then looked at what the effects were, I think, on it for about like 38 months afterwards on crime, various forms of crime. And if they looked at all neighborhoods, they found kind of their most conservative estimates were about a 4% reduction in crime around these newly cleaned lots, and a 3% reduction in gun assaults. These effects were larger when they looked at neighborhoods below the poverty line. So these went up to about a 9% reduction in gun assaults. Again, a very low cost intervention, but seemed to have large effects, particularly in more disadvantaged neighborhoods. We also have kind of strong evidence for some types of youth programming. And here, we have experimental evidence, in particular from youth summer jobs programs. So programs that give youth jobs during the summer, kind of self-explanatory. And here we have kind of this high quality experimental evidence because typically with these programs, they are a resource such that they cannot serve everyone who's eligible for them. So they use a lottery-based admission system. So researchers are able to compare kind of youth who were eligible for this program, those who kind of won the lottery and got to do the program, and those who didn't. And so this, again, this approximates that randomized experiment we want. And these studies have found really large effects of these programs, so like a 30 to 45% reduction in violent crime arrests and convictions among those that were admitted to the employment program. These effects are not just during the program. It's not just that youth are given something to do over the summer, so they're not getting arrested. They persist long after. And this has been shown across a variety of contexts, Boston, New York, and Philadelphia. And I think what's really interesting here is that when they try to unpack the mechanisms, how do these youth employment programs have their effects? The effects don't seem to be driven by long-run effects on education, employment, or earnings. Again, these are jobs programs. And what it really seems to be more about, and this is all so complex and so difficult to impact, but it seems to be some combination of improved self-efficacy, improved social skills, and some evidence of kind of this informal mentorship and this building of relationships with their supervisors in the program, which I think has implications for the design of other types of youth programming and community interventions, and thinking through that those may also be effective in reducing gun violence if they're operating through those similar mechanisms. Finally, for kind of community violence interventions, these are typically community violence interruption, that they're very mixed in their implementation, but they typically involve outreach workers from community organizations that are deeply embedded in the neighborhoods. These are typically very, very high crime, high violence neighborhoods. Go out and mediate disputes, foster nonviolence norms, and then refer high-risk individuals to various services. Here again, the evidence is mixed. These are really difficult to study, again, for the same reasons. These are typically in the highest risk communities. It's really difficult to find an appropriate comparison communities. Communities also, like the borders of communities, are not like hard lines, right? We can cross between them. So it's kind of hard to have a clean intervention and a clean control. But I just want to flag, there's this very new cool study from Chicago from the Rapid Employment and Deployment Initiative, where they actually did a randomized trial of one of these interventions. And this was only possible because they had kind of buy-in from nonprofit organizations, from community organizations, and community from, I think, a variety of philanthropic organizations. This was an expensive and lengthy randomized control trial to do, but they did it. And so some preliminary results have come out. And what the intervention involved, it was focused on, this was adult men at high risk of gun violence in high violence neighborhoods in Chicago. Again, the intervention could not serve anyone, so it's this lottery-based admission system where those who won the lottery were randomized to receive an 18-month subsidized job plus cognitive behavioral programming. And those who were not accepted or not offered the program could basically do whatever else they wanted. They weren't restricted in what else they could do. They used 3 different prongs to identify eligible participants, so to identify those at high risk of gun violence involvement. First was a predictive machine learning algorithm where they used administrative data to predict whether somebody would be involved in gun violence, either as a victim or as a perpetrator. The second was to leverage the expertise of the community outreach workers and have them just, you choose, you assign who should be eligible for this program based on your expertise. And the third, and I think this one actually, the staff at prisons and local jails was through the reentry system. I think that one got affected by COVID, and so they have a very small sample for that one. But so what I'm showing here is on the left, This is the kind of primary outcome effects for all of the READY participants at 20 months, with the green showing victimizations for shootings and homicides, the yellow showing arrests for shootings and homicides, and the dark blue showing arrests for other serious violence. You know, they find large effects, large reductions in shootings and homicides, at least in that arrest outcome, but they're pretty imprecise and uncertain. That's what that bar means. But if you look on the right figure, when they restrict to those READY participants who were referred by the community outreach workers, so referred by the community outreach prong, they find larger and statistically significant effects, both in terms of reduced victimizations from shootings and homicides and in terms of arrests, suggesting that these community outreach workers were kind of particularly good at identifying high-risk men who would likely benefit from the program. And so I think this is very cool experimental work, not experimental work, a very cool experiment that shows really promising results for how these community violence interventions might work. Okay, so we're getting kind of more rigorous evidence about state policy and about community policies or community interventions. We're seeing this, we're getting more funding, everything is going great, and then in June 2022, we get a landmark Second Amendment decision from the Supreme Court in the New York State Pistol and Rifle Association versus Bruen. So the Bruen case centered on the constitutionality of New York's concealed carry law, which was a may issue regime, so one of the more restrictive laws where law enforcement officers had discretion in who could get a concealed carry permit. And specifically to receive an unrestricted license to carry a firearm in New York, an applicant had to demonstrate quote unquote proper cause, which through case law meant that the applicant had to show a need for self-protection that was greater than that of an average person in the general population. Now, in a 6-3 majority decision written, where the opinion was written by Justice Clarence Thomas, the court held that the Second Amendment right to keep and bear arms extended beyond the home, and that the may issue law in New York and in 5 other states, including California, was not constitutional. So the direct impact of this was to make shall issue, which I believe Pennsylvania already had, but the law of the land nationwide. And this affected, you know, like I said, New York, 5 other states, and about 20% of the US population. But that actually wasn't the major impact of Bruen. Bruen had much more sweeping implications for state gun regulations, kind of writ large, because the majority opinion established a new framework for how Second Amendment cases should be decided moving forward. So prior to the Bruen decision, the lower courts had near unanimously converged on an approach for evaluating the constitutionality of Second Amendment cases that involved kind of 2 steps, the second step of which was a conventional tailoring test that involved weighing the extent to which the regulation burdened Second Amendment protected conduct, and on the other side was the extent to which the regulation kind of promoted an important governmental interest like public safety. So brought into that was how effective was this law or regulation in promoting public safety. Bruen abandoned that and said that to justify its regulation, this is taken directly from the majority opinion, the government may not simply posit that the regulation promotes an important interest. Rather, the government must demonstrate that the regulation is consistent with this nation's historical tradition of firearm regulation. On its face, this would seem to imply that contemporary problems and contemporary evidence no longer matter for determining whether a gun law is constitutional or not. All that matters is whether there are sufficient 18th and 19th century laws that are sufficiently analogous. So we're still in the fallout from this. There are more than 100, there might even be more than 200 state and federal cases currently challenging gun laws, given Bruen. There's there's disarray or turmoil in the lower courts. Judges are expressing frustration with the ambiguities left by Bruen in like what is a historical analog. We are not historians. And judges are actually making different decisions on the same types of cases. And I believe that's happening with high-capacity magazine bans. Again, very difficult to think about 18th and 19th century regulation as they relate to high-capacity magazine bans. This is happening with age limits. And this is happening with restrictions on domestic violence offenders, just to name a few. I think there's also kind of a question and a concern about, given this new part test and this kind of reliance on history and tradition, is there even really a role for research in informing gun policy moving forward, particularly when we're thinking about state gun policy? Yes, I'm biased, I'm a researcher, but I am here to tell you yes. Sorry, I was a little quick on the draw. So we think, one, there's a clear need for legal and historical research. Judges are not historians, and thus if the test is whether a modern law has a historical analog, one proximate need is research to better understand what historical firearm laws were in place in 18th and 19th century America, and how were they enforced. That also seems to be something that's weighing on judges' minds when they're trying to make these decisions. I think another proximate need, again, is, courts are really struggling with this, like, what is analogous enough? And I think one research area that would be helpful there is, and maybe a bit more like a political science research question, to know what were the motivations of those historical regulations in the first place, because if we can map those motivations onto kind of similar laws today, that gives us some kind of scoping of these being analogous. I think there's also still a really large role for public health and social science research more broadly. The Bruen decision reiterated that individual self-defense is the central component of the right to keep and bear arms, and we know so little about defensive gun use. I think there are important questions about who, how, where are guns being used defensively, what types of guns or other types of weapons are being used defensively. Without knowing this, it's difficult to know the extent to which a regulation is actually burdening self-defense. I think there's also kind of important questions around, even if we can't use contemporary empirical evidence in policymaking, I think we, the public and policymakers, want to know what the effects of the changing legal landscape are, so that we can potentially identify other strategies if there are harms to help reduce them. And I think that finally here, a really important question is, what are the mechanisms by which policies have their effects? Because if we can understand the mechanisms by which any changes might be likely to produce harms, we can think about alternative regulations to help address those mechanisms, or kind of alternative non-statutory interventions like community-based interventions to try to address or accomplish the same end as a regulation that may be being thrown out. And I think kind of just teeing off of that, I think community interventions and research on community interventions may be more important than ever, given that kind of these state policies are going to, many of them may no longer be able to be implemented in the same way that they were, but community interventions are largely going to be outside the scope of Bruen. And so I think we need to know what doesn't work, why. If something works, does it work for everyone, or is somebody left out? I think answering these questions helps us understand how to scale what works, which is important, particularly if we have an increased need in this area, and also helps ensure equitable implementation as long as we're looking at not just kind of how does this work on average, but trying to look at variable or heterogeneous impacts across individuals who are involved or communities. And I think another important question will be, does this changing legal landscape, as state policies change in the fallout from Bruen, does this change the efficacy of community interventions? How can community interventions adapt if there is increased gun carrying or other changes that follow from Bruen? Like, how can we work together kind of at the state level, at the researcher level, and at the community intervention level to ensure that effective interventions continue to be effective going forward? So just to conclude, kind of, I think, again, I come from not an advocacy perspective, but from a researcher perspective, and it can sometimes be frustrating. I think probably not as frustrating as from an advocacy perspective, honestly. But I do want to say that kind of my role here is to present the science, and I would say, though, where we have rigorous evidence, we should use it. We have really strong evidence that child access prevention laws and these efforts to promote secure storage can be helpful in reducing gun deaths and injuries among youth. And we really need to consider how we can implement these laws in a way that they can be effective, and how we can implement them in the strongest way possible. I think there's also, given the importance of the gun thefts, it's really important to identify policies that might potentially reduce gun thefts. And here I don't think we have a ton of good evidence just because of data restrictions, but we could think through lost or stolen Lost or stolen firearm reporting requirements. Again, secure storage might be one mechanism for this, but I think this is an area where we need to be creative in our policy solutions, and we also need to devote attention and research to kind of really understanding illegal gun markets and how kind of these gun thefts might be translating into violence in the community and violence among youth. And then finally, we do have really rigorous evidence for some of these community interventions. I think kind of built environment interventions and youth programming in particular have strong evidence, and to the extent that we can expand those and kind of scale those up, those could be effective ways of reducing gun violence, not just among youth, but among the communities in which youth live. I'm just going to echo Dr. Szilagyi, multi-pronged approaches. I don't even need to get into that one, but I will. I think we should be humble and recognize any single gun policy is likely to have pretty small effects. We really need to address this from multiple angles. And I think, again, in light of Bruin, and if gun policies become more challenging to use as a means of addressing this problem, we can think about other social, economic, healthcare policies that might accomplish the same ends and have additional benefits in kind of improving child and family welfare. And then finally, I really want to end on this because, sometimes I think the results from the Gun Policy American Initiative, there's a lot we don't know. And we're very transparent about that. There's a lot of areas where the evidence is just inconclusive. And sometimes that is taken as, look, this is evidence that this doesn't work, right? If we say there's inconclusive evidence around the effects of assault weapons bans, that's taken to mean that, oh, assault weapons bans don't work. And I want to just say once and for all, this is probably not the room that needs to hear this, but lack of evidence is, so an absence of evidence is not evidence of absence. And beyond that, lack of evidence is no excuse for inaction. Policy should be guided by and not constrained by rigorous evidence. To evaluate policies, someone needs to have implemented them. Somebody needs to be that first mover. And so I think we can kind of draw on theory, draw on descriptive evidence, draw on the needs of our communities and the perspectives of our communities to implement policies, even if there's not rigorous evidence behind that. But to the extent that we can, when we're doing that, it would be so helpful, I think, that for that community and for other communities to build in kind of the structure, the data, and the evaluation to help monitor it, to help evaluate it, to see whether that intervention is working the way that we want it to, and to inform interventions kind of across the country nationwide. And I have no idea on the time at this point. I feel like I'm at time. But I do want to just quickly flag, I'm not an expert in Pennsylvania. I'm not an expert in Pennsylvania data, but I did do a little research. And I actually think Pennsylvania, at least from a data perspective, is very well positioned to kind of improve our evidence base even more for what kind of community interventions and what policies work. Pennsylvania, at least certain cities and Pennsylvania as a whole currently track non-fatal gun violence in a lot better ways than a lot of other places. This is a snapshot of the Pittsburgh Gun Violence Dashboard, which produces, kind of with a little bit of a lag, but information on non-fatal shootings, aggravated assaults with a firearm, and 911 dispatches for shots fired. There's also the Philadelphia Police Department Registry, which I think publishes information on shooting victims updated daily. And then the Pennsylvania Healthcare Cost Containment Council is an independent state agency that collects, analyzes, and makes publicly available data about the cost and quality of healthcare in Pennsylvania broadly, but they've published some reports on firearm violence, firearm injury in particular. Pennsylvania also has this interesting gun tracing analytics platform, which I have not seen. It may exist in other states, but like I said, there are restrictions on the sharing of this gun trace data. And unless there are political changes, it probably can still only be released in aggregate form, but Pennsylvania actually makes that data available in a pretty user-friendly format. And there's some other opportunities that I'm going to leave here so that we have sufficient time for Q&A, but then I'm happy to talk more about. Thank you so much. Again, this is such an important event.
Well, Dr. Smart, I have only one thing to say about that presentation. Yes. And I only have one thing to say about Q&A. No, because we've got an all-star panel coming up And I know that neither Dr. Szilagyi nor Dr. Smart can leave for California tonight anyway, so you probably can corner them when they're done. And Catherine Augustine is standing up. She needs to stop for a minute, because I do want to say that it's been 23 years since RAND selected Pittsburgh as its third national headquarters city. And RAND does such amazing work. Its building sits almost equidistant between Pitt and Carnegie Mellon. They must be doing well, because it's now the RAND building and they keep kicking everybody else out. And I want to introduce Catherine Augustine, who leads the Pittsburgh office for RAND and who is here tonight. And I also want to say that Michael Rich, who led the search committee for the third headquarters city and selected Pittsburgh, then became the CEO of RAND and started the Gun Policy Initiative, and he also started the Truth Decay Initiative, and really is a leader who made a difference in this country, I think. So with those words of praise, I'm going to bring Samantha back up, and she's going to get us rolling with the panel discussion.
Oops, thanks, Mark.
And obviously, if you need a drink or you need to go to the bathroom or something, Catherine, you can leave now.
Hi, everyone. I'm going to introduce our local panelists. I'm really happy that Dr. Smart ended on the idea that community interventions are critical right now and are, effective in preventing gun violence in our communities. So I'm going to begin with Dr. Elizabeth Miller, who many of you, I'm sure, already know, but for those of you who don't, she is a professor of pediatrics and public health and clinical and translational science. She holds the Edmund McCluskey Chair in Pediatric Medical Education at the University of Pittsburgh School of Medicine. She's also director of the Division of Adolescent and Young Adult Medicine and the medical director of Community and Population Health. She serves as the academic co-director of Community Partners and for the Clinical and Translational Science Institute. You likely have heard, maybe, but if you haven't, you should hear about a landmark collective impact community partnered intervention study that Dr. Miller is co-directing called the Pittsburgh Study that seeks to identify and evaluate best practices to support child and adolescent health and thriving. Lastly, Dr. Miller is a recent has been recently distinguished as a Distinguished Daughter of Pennsylvania in 2022 by Governor and First Lady Wolf. So why don't you come up here? Next, I want to introduce you to Pastor Tim Smith. Pastor Smith is a lifelong Pittsburgh resident. He's affectionately known as PT. I didn't know that, so I'm gonna have to know that. He through the Center of Life, he founded the Center of Life in Hazelwood, and his roots are in Hazelwood. He volunteers and works there, and he has done so since the 1980s. His passion is for connecting with kids and families, which led him to create the Center of Life as a nonprofit and community empowerment organization. His philosophy of economics, environment, and empowerment includes giving people the tools they need to not only succeed, but to lead economic revitalization in Hazelwood and similar communities in the face of generational and economic discrimination. Pastor Tim has made a very purposeful decision in his life to stay in Hazelwood. He is an investment banker that decided to dedicate his life to youth programming and the work that he does in creating fellowship and connection in the Hazelwood community. So welcome, Pastor Smith. And lastly, but not least, is Dr. Jamil Bey. Dr. Bay is the founder and CEO of Urban Kind Institute. He believes that cities should be kind places for people to live, and he's inspired by the many young people he works with, challenging himself to do better at Always. He conducts community participatory research across the city. He has a background in a PhD and a Master of Science from Penn State University in geography and a bachelor's degree in education. He believes in stirring critical thinking and facilitating tough conversations around the issues of race, equity, and systemic change. And we're really glad to have him here today. Okay. We decided the seating was based on Liz being able to get the end because we're the same height and we have to have our feet touch the floor. Okay, so yeah, can you all hear me? Is my mic working? Okay. Pastor Tim, I want to have a conversation about the community interventions that Dr. Smart talked about and also that Dr. Szilagyi has touched upon. And I want to begin with you because of the work that you do in Hazelwood and the experience that you have had. When we spoke last week, you shared with me that the incidence of gun violence in Hazelwood was once so pronounced that in your role as pastor of the Keystone Church, the number of funerals that you officiated for Black boys and men ages 14 to 26 became overwhelming. But that's changed now. And I'd like for you to comment on what do you think is working and what has changed?
Well, I think what's working is the fact that really the whole, the one cliche that we use, it takes a village to raise a child. I think at some point we got that in Hazelwood. And we all really came together and we created a collaboration of organizations that work together to, really fill in a lot of the gaps that we had in terms of providing services to families, children, youth, to dealing with whether it be mental health or physical health or, all the things that were kind of missing, education, and we pulled it together. And that's when we started an organization called the Greater Hazelwood Community Collaborative, and it's a collaboration of about 41 service providers, both community-based and non-community-based. So we came together and did that, and through that, we created our Greater Hazelwood Neighborhood Plan, which was accepted by the Planning Commission back in 2019. So it's been working pretty well,
And when we spoke last week, you made a really profound comment that was exceptionally concerning, but I also think touched on the complexity of the topic that we're dealing with today, which is gun violence. You said for a lot of kids out there right now, it is easier for them to get a gun than to get a healthy meal. Can you comment on what that means in your community now and the broader community in our region?
Yeah, well, in our community, we don't have, we have a grocery store in our community now. We have a small grocery store, and they do sell healthy food. But for years before that, we didn't have a grocery store. And we didn't have a store that sold healthy, any kind of healthy food at all. It was basically just junk food. But it's always been easy for young people to find guns in our community. And I think that is not unique to Hazelwood. I think that is unique to underserved communities, in particular, communities where people of color across the country. Guns and drugs have been the economic driver for a long time, much like during the Prohibition when alcohol was illegal, but it was being sold, and it was being sold to law enforcement and to judges and doctors and everything else. Well, guns and drugs have been brought into our communities forever. And so we have no shortage of guns. We have no shortage of drugs. So it's always been easy for kids to get a gun in our community.
And how important then it is for the healthy meal and the
Yeah.
opportunities for communities for children to thrive. Dr. Miller, can you talk about the Pittsburgh study and, in the absence of being able to affect immediate policy change relating to child access to guns, how is the Pittsburgh study approaching, understanding where communities and children thrive?
Yeah, thank you so much. And what an incredible honor and privilege it is to be here this evening with all of you, two extraordinary speakers. Thank you so much, Dr. Szilagyi and Dr. Smart. And then with two of my really dear friends and colleagues here in this collaborative work together. But I'm going to start actually, before I talk about the Pittsburgh study and the work that we need to do to continue to nurture the village, is to actually stop and speak as a pediatrician. Because the last 6 months or so have been the hardest ever for me as a clinician. I have lost more of my patients to gun violence than in my entire career. And it has been heart-wrenching. And the ripple effects, of course, for so many of the young people I take care of. I had to stop asking my patients how many friends and loved ones they've lost to gun violence. I had a young person just last week, he's like, I don't know, Dr. Liz, 20? Right. And so, just again, all of us take a deep breath, right? Because the work, as Dr. Szilagyi was saying, is that we have to persist, but it is hard. And my heart has been broken so much recently. And it is in that context that it's an incredible privilege to be a clinician and to sit with young people and families and to be able to support them in their grief and bereavement and to support them on that pathway to healing and recovery. And we're incredibly proud at Children's Hospital to have a robust violence intervention program working side by side with our community partners, extensive group of community mentors who have been trained to support young people who've been injured from gun violence, assault injury, and all of those things that we're doing in the healing space. But the Pittsburgh study is really about thinking more upstream, right? It's thinking about the healthy meals, but I'm seeing my friend Gabe over here, and I'm thinking about trees and planting trees. And you're like, what is she talking about? What does planting trees have anything to do with this? And it's about creating safe, supportive, healthy environments for our children. And that's what the Pittsburgh study is about. It is a ridiculously audacious vision that in our region, every child should be thriving and that we should be promoting racial equity. We are living in a city and in a region that is profoundly racially segregated. We've documented this compared to 89 other cities in the country. We rank the lowest on things like school suspensions and police referrals for our young people, and disproportionately impacting our brown and black children. And so the Pittsburgh study was really trying to flip the narrative to focus not on what is bad and broken and needs fixing, but to really set our sights on what it means to support health and thriving and our responsibility for creating safe, supportive, inclusive, nurturing environments for all of our young people. And I'm going to toss this over to Jamil in a moment because, this is work that we have been doing together now for the last 5 years.
With no prompt, just toss it.
Toss it over.
Okay. Hello and thank you. I really could go anywhere with this because, I was so excited. I mean, the presentations and the conversations, I can pick any piece about that and connect it to work that we're doing and talk about that in a comprehensive, deep way. But I think the thing that really just pulled it, one takeaway for me in the work that I do and the way that I like to engage communities, when Dr. Smart, when you talked about what can we do, and that I I think the biggest promise at scale is for us to really think about the economic and the social and the cultural ways that we can think about this. This is a country that's awash with guns, like you said. You know, like Kai Risdell's thing, that there are more places to legally buy a gun in the United States than there are Starbucks in the world, okay? And that's not talking about the illegal access. Mm-hmm. But when we think about using guns, and this is what you talked about, the decision, however that's made, to pull a trigger. What is going on in that person? You know, and it connects to all kinds of insecurities. Social insecurity, you know, I don't have the friends, I don't have the people to talk to, I need to get this out. Economic insecurity, housing insecurity, health insecurity, food insecurity. And we think about how we think about black people in this country and indigenous people in this country, and the policies that we have done that have excluded them from the economy, from political access, from social access, all of those things that, you know, as a parent, you know, my parents are still alive, as grandparents, they want the same thing that everybody else wants for their children. But the access, the insecurities in these communities, and let's turn the lens around. Let's not study the communities. Let's study what we've done as a society. What has our economy done to be inclusive, to give everybody access, to give everybody an opportunity? And if we're going to eliminate those insecurities, we have to invest those things in families, in people, at scale, because as it is now, none of us are safe, really. Mm-hmm. Like the mall, Walmart, you know, at school, mm-hmm. at church, we're all vulnerable because we've excluded that key insight into what's creating these insecurities. It's our indifference to other people. Is that the...
That was
okay.
exactly right. Like
I don't know what the question was, but don't just give me an open mic and say.
Yeah, well, right. Yes. Thank you.
Pastor Tim, how would you respond to that? I mean, I think about the work that you've done in Hazelwood, and for those of you who don't know this, but in 2017, Center of Life unveiled an exhibit called I Lived, We Live, What Did We Miss? And that was an exhibit to show the impact of gun violence in Hazelwood and preserve the legacy of its victims. Where I'm going with this is that told stories and brought people together, brought families together. And I look at the work that you've done and what I've learned about Hazelwood since, and I wonder, how do we get more Tim Smiths and more Center of Life folks? Like, what do you recommend to other communities and to the larger Pittsburgh region based on the progress that you've been able to make bringing people together in Hazelwood?
Yes, so the exhibit was really, we wanted to put the exhibit together because we wanted to tell the story of Hazelwood from where it started to where it is now, and then kind of project into the future. So we went back to the beginnings of Hazelwood, where Native Americans lived in Hazelwood, and then later, you know, Hungarians came and Italians came, and on and on and on and on. And it was a very affluent community. Hazelwood was. It was Hazelwood, PA. It wasn't even a part of Pittsburgh. Hazelwood, PA had its own mayor, its own chamber of commerce, all of those things. Businesses everywhere, gas stations, grocery stores, everything, shoe stores, everything was there. And then at some point, as time went on, the people who were, you know, the more affluent people who lived in the community didn't want to live in the same community with the people who worked in their companies, and so they moved out. And then later, as time went on, the steel mill, which was the largest employer in the community, the steel mill began to downsize. People began to lose their jobs. They began to move away, and next thing you know, we hardly had anything into the community. I mean, it got all the way down to us not having any schools, nowhere to shop, no gas stations, it was just hardly anything in the we had a YMCA that was a one-room Y, so it was the old outreach model. So it was a one room with a couple pool tables and a foosball or something, and that was pretty much it. We did this exhibit in connection with Carnegie Mellon University, where we had about 33 students that were international. Most of them were international students, and we had 28 parents from Hazelwood. And the idea was for them to build relationships with each other and to have conversations with each other about what Hazelwood was like, and just, so we needed to educate the students, and then the students wanted to talk to us because they were art students. So these students were from the School of Design. They were from the School of Design, and we had several speakers come in from Hazelwood that we could talk to them about what it was like growing up in the community. And so it wasn't, the exhibit wasn't just about gun violence, but it was about how when a city, because it was almost like, the Hazelwood city, but it was really Hazelwood, is divested. When you're divested of that community, and when the funding that is supposed to come into communities like that never get there, then you leave in its wake. You leave, again, the economic driver becomes what the commodity is, and in that case, there were guns and there was drugs. And there were people in the community that had jobs outside of the community, but for the people who were disenfranchised and discriminated against, some of them were able to get guns, they were able to sell drugs, they were able to send their kids to college, they were able, it was a lot of different, the drug dealers sent their kids to my programs. So they were in my programs, and because they did not want their kids to do what they were doing. And so, that was what we saw. But we saw, when she talked about the Keystone Church, I started pastoring Keystone in 2000. But before that, I started in the ministry when I was in my early 20s, and I remember I was 26 and I was doing the funeral of a 26. I was 27 and I was doing the funeral of a 26-year-old boy. And prior to that, I had been doing funerals for boys who had been shot between the age of 14 and 26. And I realized when I was doing that funeral that I was older than the kids that I was doing the funeral for. And over time, I lost track of all the funerals that I had to do. And that was a part of the exhibit, was really one of the trademarks of the exhibit was empty picture frame, which basically just was empty because we were saying that these kids, they had great potential, but they had very little opportunity, very little access to resources, substandard education. There was, and those were some of the things that were at play, so there was, a kid is born, and this is not a stab on teachers at all, so believe me, I love teachers, but some of these kids went to schools where they got a substandard education, and getting a substandard education sometimes, gets you kicked out of school, and then you get kicked out of school, you have to deal with, police officers, and some of the police officers were not good police officers. So you got substandard education, bad policing, you ended up in the courts, and then from the courts you go to prison. And capitalism runs through all four of those siblings, and I call them siblings because that's the school to prison pipeline. And and some just come back and they do it again and again and again. And I think we need to make sure that we understand that every human being needs to have a sense of belonging, a sense of significance, and a sense of security. Every human being needs to have a strong family. They need to be able to feed their family, provide for their family, have the absolute best education possible, access to the best technology and everything else, a nice home. Every human being should have that. There's no reason why every human being in America can't have that. But when there are communities across the country that have people, human beings, growing up in those places. And we should do that as early as possible. At the earliest age possible, human beings need to have access to the best of whatever we have, you know, that we can offer human beings. And when that doesn't happen, somebody has to find a way, you know, and it causes mental health, mental stress. When you can't provide for your family, and when you can look, you can cross a street and be in a neighborhood where there's a, you know, $5 million home, and you just look and you see cars that, you know, you can't have that car. You don't have that grocery store in your community. You don't have that, you know, you don't have that school. And you see that kind of stuff, and it just makes you angry. Mm-hmm. It doesn't make you angry, but you get angry. You know, you get angry, and you're like, you know, and then the law of the jungle kicks in. You know, what's yours is mine because I'll take it. What's mine is mine because I'll keep it. You know, I mean, there's a lot of things that happen in the human mind when people are kept from getting things that they just should have. Mm-hmm. It just should be a matter of fact. They should have it. You know, and the question becomes, you know, if I can go to the South Hills or if I can go to the North Hills and see people thriving, but then I have to go back to Hazelwood and see people really struggling, living at or below the poverty level. And the question becomes again, why? You know, why should that happen when we all live in the same city? Mm-hmm. So building relationships with universities has really helped us, bringing in people from other, you know, organizations, nonprofits, things like that. All of those things have really helped. The collaborations have helped a lot, but we still need, you know, we still need help. And I'll stop there because I want to talk about development a little bit because I think that's really key to the story too. Yeah. Because people think that development means progress a lot of times, and it's like a mirage. It's like something that we think something special is happening in the community when development comes, but a lot of times people are being driven out of their community because tax bases go up, and you still have people living either at or below the poverty level, but you have beautiful buildings, and that's a difficult thing to try to navigate.
So, I mean, what I hear you talking about is a number of longer-term solutions that take special leadership, commitment to fellowship and connectivity, and I think we all want to promote that and have a role in providing that. What can be done in the shorter term? Can any of you talk about that? Liz, you're nodding. Jamil? Do you want to go first?
I mean, there's a lot of good stuff that is happening. I said we can't focus on one thing. And one of my favorite efforts right now is this initiative that we have called Trust Trees, right? And it accomplishes a lot, and it sort of builds on, you referenced Michelle Kondo's work in Philadelphia and the U.S. Forestry Service. And the idea of Trust Trees, you know, I'm a geographer, and I'm concerned about the planet, and we all know that trees benefit. It's not an easy sell to go into a community and say, hey, look, we need more trees, we're going to reforest, and, you know, communities are going to thrive. Yeah. That's not, you know, you're not going to get a lot of traction. And so the idea is, what's important in your community? What's going on? Let's listen, let's hear you. Inevitably, the list of things that you want to do, hey, kids need more play spaces, we need better access, you know, the energy bills are too high, the kids' asthma's flared, you know, all of these things. Well, trees are a part of that solution and can be, and we can connect them. You know, it's like 7 degrees to Kevin Bacon. You know, I can get you the trees in 2 degrees. You know, there's a tree. But the idea is, okay, while we're doing these other things and we're working to do this, let's do this. Let's think about trees as community building initiatives. Let's invite people into the neighborhood. Let's beautify these spaces with families. And, you know, you see this stand of oaks that are 120 years old. Look at this photo from 1908 when they were saplings. Let's get you, your grandmother, your uncle, let's put trees in the ground, get your pictures now so that you can tell your grandkids, these are our trees, we did this. Mm-hmm. And in that community, you know, we're building community capacity, we're building community efficacy. while we're doing these other things that, look, these kids now have adult relationships. They're a part of something bigger. You're growing a community while you're improving the community. And now we're building up enough community capacity where this community organization can now say, hey, we want to work on these other issues too. And funders and council folks see that they are organized and ready to do that. And so we had this weekend in McKinley Park, Tree Pittsburgh and the Parks Conservancy, we told them we don't want any more outsiders planting trees in our community. And when Dick's and Ernst & Young's want to do a day, let those come. We'll come and we'll do the litter pickups. But the trees are legacy projects. They have no problem getting volunteers. And it's, volunteers are bumping into each other from the community because we see that as a community building process.
That's great.
It's not a gun producer, it's not an anti-violence, it's not, we don't say that. But it has the same impact because it's building relationships in those spaces and something that's tangible.
I love trees.
Right. See, I told you it's about trees, right?
But Dr. Miller, what were you going to add?
What I'm going to add is to share with you that Jamil and I first met when he was pulling together a meeting to talk about youth development and putting young people kind of at the center of solutions. And and then we became fast friends, and then the Pittsburgh study. So I think one of the things that we really need to do is focus on our young people who are amazing. And one of the sort of slippery parts of the narrative that's happening with the child and adolescent mental health crisis, we're starting to slip into our kids are broken kind of narrative. And really our kids are not broken. Our systems are broken, and you've heard a lot about that. And that's really what we're trying to do in the work in the Pittsburgh study by focusing on thriving, is to really think about how do we create systems and structures and scaffolding so that our children and young people can thrive. And shifting that narrative means every opportunity, right? We should have young people in the room with us, thinking about solutions, lifting them up, and making sure that we have after-school programs. I saw my friend Cindy Haynes over here from Focus on Renewal, right? Every single day in the McKees Rocks community, her team is there providing safe and supportive environments for young people, right? Every day, Center of Life in Hazelwood, right? Doing this extraordinary work. That needs to be replicated multiple times, right, across all of our neighborhoods, and we have the resources to do so. We have a lot of money in community violence prevention, a lot of money in mental health, and instead of focusing on risks and deficits, we could really be investing in all of these positive places and spaces for young people.
Can someone talk briefly about the school-to-prison pipeline? And I believe it was Dr. Szilagyi that talked about the 5 common characteristics that we see with mass shooters and the punitive responses that those kids typically get within the school systems. What do we do about that? How do we build partnerships with schools to create less punitive responses to what is a cry for help? Anyone?
I'll take it. I'll start, I guess. I think there has to be, the schools and the community and the homes, they all have to trust each other and work together. I mean, those are 3 areas where kids spend the most of their times, either in their school, in their community, in their schools, or in their homes. And there has to be a tight partnership between the 3 of them. And this idea of a child being suspended or expelled from school for being a child, or for having a temper tantrum, whatever the case might be, is just really, there's no excuse for it. I mean, that's like saying you're not going to get another chance. We're going to have to kick you out. And you set a pattern. You set a pattern for these kids to say, well, I'm going to get kicked out anyway, so I might as well do I might as well do what I want to do anyway. And there's just not enough creativity. And honestly, I get, it gets back to me also to resources and exposure to things that, will really build up the creativity of the child. When I was growing up, I could have fun with a rock. I used to make paper men, Today, there's cell phones.
Yeah.
And there's, all kinds of computers and technology and things. But I think that all the schools are not created equal. Mm-hmm. So there's some teachers that are working with very few resources. Mm-hmm. And then there's some teachers that are extremely creative, but their hands are tied by some of the systems that, the way the schools are set up. And so, and again, I'm a public school person. I believe in public education. But I think we're a bit antiquated by the way we continue to do things. We don't take everything into consideration. They certainly didn't take me into consideration. Mm-hmm. So I'm dyslexic. So, and there was no place for me in school. And so they had to put me in a room by myself downstairs in the basement with this teacher who I really had a crush on. I was in the third grade or fourth grade or something like that. I was like in the third or fourth grade and I could not read, But boy, she taught me how to read, man. And she had my full attention. I mean, but, I just remember her, Miss Gore. I remember Miss Gore. So, I'll never forget. But anyway, but there's not enough diversity within our schools. There's not enough teachers. Like I think in PPS, you have, I forget what the percentage of white teachers to black teachers to male to female. I forget what those percentages are, but I know that there are very few, African American teachers in PPS. And it's not that they're not around. I mean, they're around, but we have to trust. We have to trust each other. I know that the mother and the father in the community is a teacher. Those are teachers, and the schools have teachers and the homes have teachers. There's teachers everywhere around us, but we have to learn how to pull all those pieces together, because we do have to deal with law enforcement, and all police officers aren't bad, but there's some police officers who are very afraid of black people, and because of that, it's the worst thing you can have in the world is a law enforcement person with a gun and a taser that's afraid of you. That's the worst thing, and there are African Americans who face that every single day, and so with that, and then you have the courts. And I was in court today with a young man, and they threw the book out. And I'm thinking, I knew this kid ever since he was in kindergarten. He's a grown man now, he's 31. But they threw the book at this kid. And I see him as a kid. And I think about what he had to work with when he was growing up, which was less than nothing. And so, I'm looking at all this and I continue to see the same pattern, generation after generation, that leads to more and more people of color in prison for inordinate amount of times where there is no rehabilitation. There's no rehabilitation. And so they come out and there's nothing to do.
Samantha, can I share a happy story?
Sure.
But we've got time. Mm-hmm. A very, very quick one, because there is opportunity to totally change the narrative in our school districts as well, right? To shift towards one that is much more healing-centered, right, to Dr. Szilagyi's point, right, where you can actually think about supporting staff and teachers and parents and children in a healthy and thriving school, right? And the superintendent at Steel Valley School District has been extraordinary, because instead of putting mental health dollars into more therapists, he's investing in community members, including the woman who's sits in the administration office, in the main office every day. And we're using some of those dollars for evenings and weekends for her to call parents and talk to them about how fabulous their kids have been in the teen leadership program, what the middle schoolers did reading to the kindergartners. And she's like, did you know your son Joey did this like amazing thing? And as a parent, she said, nobody has ever called me from the school district to say anything good about my kids, and we're gonna change that, right? It doesn't take an immense amount of dollars. It just takes wanting to shift the narrative to one where we're all building community together.
And we built relationships with our police, department that covers our station as well. So the police officers would come down and sit with our students, and they wouldn't have their uniforms on, but they would sit with our students. They built relationships with each other, and out of that came some real friendships and some real trust, because now it wasn't just another kid. It was a kid whose face they recognized, and they recognized them in a way where they could help them stay out of trouble. And so I think those are other ways, like really building those relationships with the service providers and things.
Well, we're close to time, and I just want to end with the note that, once upon a time, all of these ideas were just good ideas that we all wanted to achieve. But now they're critical needs for us all to come together and to approach this problem from multiple perspectives. And so I really want to thank the three of you, our keynote speakers, but I also want to put a shout out to all of the folks who we all know who are already working on gun violence prevention in our communities and working really hard and have been working really hard to make the world a safer place for kids. So thank you to all those people. Mark, do you want to come up? And I really want to thank you again. Michael. Just quickly, I wanted to mention that Michael Jonas with the Pittsburgh Foundation is here, as is Bobby Watt-Gear from the United Way of Southwestern Pennsylvania. And one of the goals of this program and the three programs is to build awareness, but also bring people together to really solve what we all consider this is an epidemic, and an epidemic has to be solved by a lot of people. So, thank you.
And in terms of that last shout out that Sam gave, that includes so many people in the audience here tonight. The commitment and the capabilities and the contributions that we have seen from our guests on the couch and our guests who have reclaimed their seats in the audience, I know is also duplicated in the lives of so many people in the audience who are working on these issues every day, who may want to get more involved in some of these issues, and getting us all together because we know something's got to be done. And we may have some ideas about what should be done. But we've got to decide what can be done and then kind of all put our efforts behind that to make a difference in this community and more broadly. There was a real emphasis on community initiatives in the presentations tonight, and I do want to say that the third forum, which is principally the responsibility of the United Way of Southwestern Pennsylvania, is going to deal with mobilizing communities for action, how organizations can come together to prevent gun violence. And the two keynote speakers that evening are going to be Anthony Smith, who is the Executive Director of Cities United, and Sean Garrett, who is the CEO of the United Way of Metro Chicago. And I know that we will have local leaders that night, too. So thanks to everybody. The three all-stars who sit before us now, our keynote speakers, and everybody else for being here tonight and for everything you're doing to make this community a better place day in and day out. We all need each other, and so let's push forward together. Thank you again.